Welcome to the office.
Hi, Gabriella.
Hi.
Nice to meet you.
Nice to meet you too.
What you doing here?
I'm having some pain in my back for like the past 3 years maybe.
Some pain for 3 years.
First year, I was deadlifting.
Okay.
And
So you work out a lot.
Yeah.
And you're 3 years ago, how long were you deadlifting up until that period?
Maybe like a year.
So you just started getting into weight training?
No,
lifting.
3 years ago. Yeah.
So you were a year into training?
Yeah.
Okay. And then what happened?
And then I started jump roping.
Yep.
And I felt my back just give out after that. I couldn't walk.
What do you mean give out?
Like
weak, pain,
both.
No power?
Both, all.
Okay. And it was during a deadlift or it was just random?
It was after the jump roping.
After the jump roping. But you were deadlifting and then went to a jump rope?
Right.
How much weight? Couple hundred?
Like 140.
Okay. All right.
But I was like 120, so it felt like a lot.
It was a lot.
Yeah.
All right. And that was 3 years ago?
Ish, yeah.
So what happened?
So then I was okay. Then there was like a year.
Wait, what did you do for it?
I went to the chiropractor.
Okay.
I rested, which they told me that was just what I had to do. I did get an X-ray for that. I got an MRI for that. They said there was a slight herniation in the last 2 discs of the thoracic.
T11, T12?
No, sorry, not thoracic.
L4,
lumbar.
L5.
Yes,
okay.
those 2.
Okay.
Those ones, that it was a slight bulge. He said, you're fine.
Sure.
Just rest. Super tiny. Can't even tell anything's wrong with it. He said, okay.
Okay.
Waited a year. After a year.
Waited a year for what?
Healing. Just took it easy. Didn't do anything crazy at the gym. No more deadlifts. Just took my time.
Okay.
Didn't do anything to aggravate my back.
Okay.
And then after that, after like a year, I was feeling a lot better. Started doing a little bit more squats, doing a little more putting pressure on my back, and I was feeling
Back
good.
squats, front squats?
Back.
Okay.
I was feeling better. And then I got in a car accident.
Okay.
And I got in the car accident. I got rear-ended on the freeway, going pretty fast. So then after that, I went straight to the chiropractor that day.
When you got in the car accident, you felt it in your back and your neck?
Yeah, it was both.
You just wanted to get tuned up and adjusted, right?
Yeah,
okay.
They said I had whiplash in my neck, but I knew that was probably gonna happen.
She's a tough girl, right, Dad?
But the pain that I felt in my back was oh shoot.
Low back.
Low back.
So it felt like it was all over again.
Right,
yes.
But worse this time. And so went to the chiropractor. He adjusted me. He kept adjusting
Adjusting
me.
what?
I don't know. He didn't take any x-rays.
Stop! I gotta interject here. Guys, I just gotta say something. I'm sorry. It's not you personally. This is the typical story of everyone coming in where, okay, so you saw a chiropractor, fantastic. I don't even care about the method or technique at the moment, okay? But the first question I ask somebody when they said, I've gone to the chiropractor, I'm asking you, what did they find? What's the issue? L5, sacrum, pelvis, right side, left side, S1, S2, T5, like what is it?
Right.
You go to the dentist, you're going to know what tooth they're working on.
Yeah.
And in any discipline you go to, they're going to tell you what they're doing.
Right.
So why not the chiro? And I'm going to put it on the patients out there now. You need to ask your chiropractor, what specifically are you adjusting?
It wasn't until he released me from his care.
Okay.
After 3 months.
That was during the accident, though.
This was right after the accident.
So you were under care for the accident.
Right.
Correct. Okay.
Right.
Go
3
on.
months.
Yep.
So he released me, and I was at a loss. I was not better at all. Still had no idea what's wrong with me. It wasn't until then that I went and I got
the MRI.
The MRI. MRI said, you don't look good.
Okay.
And it was the last 4 discs that were herniated this time.
Okay.
And a lot more. We went to pain management.
Sure.
And a lot worse the pain management doctor said, you're never going to get better. You're just going to have to deal with this for the rest of your life. You could, we could help you. We could either do epidural injections. He talked about a surgery. He said he doesn't want to do surgery because I'm so young. So he said, just, wait. This will probably come back up later on. When it does come back up later on, then we can discuss the surgery. So
that's why we're here.
And just to keep things very simple for right now, you don't know what the issue was. You had a lying down MRI which showed multiple herniated discs, but I'm going to show you it wasn't any of those today. I'm going to show you what it is. You're going to get your answer today. And if you want to do deadlifts again, you'll do deadlifts again, okay?
Okay.
But you got to bear with me for a few adjustments. And just, you're not doing weights right now anyway, right?
Mm-mm.
Okay, so just a few adjustments. We'll figure out, show you exactly what the issue is, get you right, and then get you training again.
Okay.
Deal?
Yeah.
All
I will
right.
say I did get an epidural injection.
Okay.
Because I wasn't.
That was part of the case.
Right.
So that's your number one issue.
Right.
Okay, let's go over your x-rays then. So let's talk about the foundation first. There are other findings here I will be mentioning too, and other things that I need you to get checked out. Okay, Papa? So let's look at your foundation. In order to have a stable building, we need a level base and foundation. Do we have a level base and foundation? No, we do not. It's not so bad, but it is off. You have a rotated sacrum. It's only 1 millimeter on the left, but it's dropped down 2, which gives us a lot of information. And then we have the rotated pelvis. Now, you've watched long format? You've watched the x-ray stuff, all of it. Okay, so cool. You have not yet. Okay, so you're gonna really appreciate it if you start watching them today, okay?
Okay.
And at least the Xray analysis to understand
Okay.
what I'm actually doing here and
Got
the
it.
process. Now, the way the pelvis works, right? They work in opposite. One goes up, the other goes down, one goes in, the other goes out. I want you to see this joint. They call this SI joint an auricular surface. It's the shape of an auricle, just like the ear, right? It's got that shape. And they have little tongue and grooves inside. And this is how the SI joint works. When it goes up, AS, it naturally wants to go in. When it goes PI, posterior inferior, it naturally wants to come out. When we see PIIN or ASEX, that's trauma. So this isn't posture, so I'm going to agree there was whether it was the accident or whether it was a slip or a fall before. Okay, whatever it is, yes, definitely. So we have the pelvic misalignment with the sacral misalignment. We have a slightly lowered leg, 3 millimeters on the right side. I'm okay with that, and I'll tell you why. Anything under 7 millimeters, adjustments will hold. Okay, normal variant, but 2 of it is coming from the tailbone. So we may be able to actually get it up a little bit, okay? The dropped sacrum and leg caused this rotation. Let's go over into this more detail now. And let's go and check it out. I might just darken it up a little bit. All right. Okay, that's fine. All right, so we know the foundation is a little bit off. From there, what's the next thing to go off? L5. L5. Slight tilt up on the left causes this to continue up. There's a finding in her ribs that I'm going to mention. It's in all my videos when I see this. You have flailing of the ribs or calcification of the costochondral junction. You see all this excess calcium in there. It's not supposed to be there. Whenever I see that, I tell the patient, please get their thyroid checked. And we'll continue with that later, okay? But let's get the thyroid checked. All of this, so it tilts, comes back to neutral. But then what does it do again? Tilts to the right, comes back to neutral. Now it goes to the left. And that's where you're placing your bar, which 1, 2, 3. You have a T3 side slip here, and that's right. 1, 2, you're putting the bar right there. Tender, right? Yeah. So T1, T2, T3. T3 is a potential we got to deal with. So, and then we go up. And this T3 side slip, T2 side slips with it, causes this slight kink towards the right side. And then what happens? The right side's going to kink up again and compensate, making it look like there's an upper cervical problem.
I had a pinched nerve in my neck. Is that from that?
Maybe. So when I run the meter on your back, the meter will tell me exactly where it is.
Okay.
X-ray will tell us exactly how to correct it. But do you understand all of this goes back to the foundation, ma'am?
Right.
You do understand that, right?
Yeah.
Okay, your digestion is also a little bit off. Her Megan Blasi is almost absent. There's the gastric air bubble right there. Should be a big black half circle, and then we got a lot of undigested food going through the colon. And we will give you a couple of recommendations on that. The fact that you're young enough, you know, I normally supplement everyone that's older. I don't need to do that with you, but we'll see a couple of adjustments. I'll explain what I expect to happen. And if it doesn't happen, then I may do short-term supplementation for her digestion. Okay? Short-term stuff. Now, let's go over the fun stuff. This is the side profile. Side profile, we're looking at curve, disc, and posture. Curvature, we should have a 60-degree curve in the low back, 60 in the mid, 60 in the upper. You're actually losing some curve, right? It's a little straighter than it needs to be. And if we look at the posture, so from the lowest lumbar, this should go through the base of the neck here and here. And so what it's showing us, you carry your upper body slightly behind the foundation. So guess what, yo? Putting a bar on the back of your neck with a sway back ain't gonna do you no good. We're gonna get your curves right first, and then you're gonna start training proper the right way.
Okay.
Got it? All right. So we need to get all this stuff forward, okay? And the question is, where is it coming from? Now, here's the good news before I go back down, and I'll start from here. Your discs are fine, dude, okay? Your discs are fine. All right, so now let's look at the tailbone and see what happened in the tailbone. Did we have any issue? Mira, there it is, S4, right there. You hit your tailbone, you said? Or no?
I can't remember.
Look at that. That should be a smooth arc. We got a nub. That thing is shifted back right there. Something went off there. S4. Now, looking at your discs, okay? You have a leveled disc there. It is a little bit less, yes, but it's leveled, okay? This is there. Again, it's a little less, but it's good. This starts to get proper. Now this, we're looking at these circle patterns. That's because of the curve in the spine. And that's from the drop sacrum causing the curvature issue. These are compensations. These are not your issues. It's starting all right here, ma'am. And if we talk about we'll get to that. These discs are all fine. These discs are all fine. You have some ligament issues in your neck. Yes, 2, 3, 4. You were getting your neck twisted a lot, huh?
I don't even know. I've had neck issues for like years.
So there's a disconnect in the ligament. So what, you can look this up later. George's line. George's line is a line that is a contiguous line that connects the posterior vertebral bodies. You have a disconnect in George's line from 2, 3, 4, and 5. That's why your neck pops and crackles a lot. And then you have to kind of force it. Make a sense? Okay. So I'll give you all your homework, don't worry. And again, remember your blessing is your age. That you have time to heal, okay? And you have to change some habits. I just say it a lot. 3, huh?
3.
3, huh? Right on. All right, does that make sense?
Yes.
Okay, have a seat on the chair. I'm going to explain another concept and then we'll get started. Sit over here. Global motion versus intersegmental motion. The motion was defined by White and Punjabi clinical biomechanics of the spine. They have documented and quantified how much each bone moves in the spine. So we have flexion, extension, side bend, and twist. Okay, global motion. I say, hey, Gabriella, touch your toes. Go ahead and touch your toes. Go touch. Touch, go down, touch. So you can do that, right? That's global motion of the whole spine. Intersegmental motion is each bone moves a certain amount to create this global motion. If one segment is stuck, 2, 3, 4 segments above become hypermobile to compensate for the stuck joint.
Makes sense.
You put the person on their back, the stuck joint don't move. The hypermobile segment moves, making it appear to be a
Herniated disc?
or a positive finding. All right, relax the shoulders. Starting at the base of the neck. And the first thing we're getting, Dad, uncrush your arms, please. Dad, uncrush your arms, please. It's an energy thing. Some of my old videos. First thing we're getting is T5, T6, left side, 10 points. That's her digestion. L1, left side, 5 points. There it is. S4, right side, 6 points right there. Uh-huh. By the way, nothing showed up at L5. It's tender, right? Watch. 5. Tender, yes? Mm-hmm. But let's go down. 1. More. 2. 3. Come back.
I'm not liking this anymore.
4.
Ow.
That's the one. So there's issues in L4 and L5, but it's not starting there.
Right.
It's starting down on S4. S4. Head down, please. Let's do static palpation. Hands on your lap. Head down. And you can see the edema pools right there at her compass. Or whatever. What's this thing? I don't know what it is. 1, 2, 3, 5. That's 6. That's 5. 6. Yes?
Yeah.
7. Not as bad. 6. 6, S4. Let's check the neck. Scoot back for me. Relax the head, please. See one on the left. Let's check. 6, 7, 6, 5, 4. Now remember I said there's a disconnect here, so I'm not touching your mid-cervicals. I can do 1 up top or I can do 7 at the bottom. And the way we're going to decide is this. We're going to do what's called Divore's test. Look up in extension. Come straight. In extension, we're going to go left. This is isolating the lower cervical spine. Right side is okay. Little bit on that left, but not so bad. Head down. We're isolating the upper cervical spine. Left. Right there. You feel that? Mm-hmm. More on the top.
Yeah.
Okay, stand up for me, please. Let's watch the walk. Stand over here. Walk to the corner of the room and back. Dad, I may be changing her profession. You know that, right? Just walk. Regular walk. That's how you walk. Come on, dude. Walk.
Yes.
Walk.
That's how I walk. I walk like this. Sorry.
She got the little Whittier wiggle. Walk it out. You get me, right, Dad? You've watched it, you know. All right. Yeah, she definitely got the Whittier wiggle. Keep walking one more time. Okay. You're not very fluid in your walk. You're a little rigid, okay? And I think a lot of this, you have some compensations in the body, so you're a little guarded when you walk too. And it's understandable. So here's what we're going to do. We're going to start on your tailbone, S4. Okay? We're going to do T6, then we're going to do the neck. Okay. After that, I'm going to tune up your extremities, meaning your ankles, shoulders, elbows, and wrists. We're going to dial everything in. Okay? Okay? You ready? I think Gabriella needs to experience the cobra today, Daddy. Talk! Yeah, we're going to get the cobra. Yeah, seriously. I'm going to have to do it. So what I'm really doing is holding that S4. Gotcha.
What though?
That's the home run, baby.
That didn't hurt.
Come on up. It's not supposed to.
Oh, good.
Walk it out. Check it out. Let's go right side down. Get a little bit more, please. Now, I typically don't like to be on the thing. I'm going to see if I can just go on the thing. I'm going to be here, okay? Right here. I got to hook it. Relax that bottom leg. Don't bend it, please. Let that bottom leg go forward. That's a baby one. Come on up. Let's go face down over here. There you go. All right, slide up a tiny bit more. Okay, we're going to do more of S4. We're going to use the drop board. It's going to sound like that. Okay? It's not your back breaking. And we want to torque up on the left. Gotcha.
Wow.
Gotcha. That's the worst of it, okay?
All right.
Head down. T6. That's the home run, baby. Gotcha. Walk to the corner of the room and back. As you're walking, tell us what's different. Turn around. Come here. Come here. Come here. Come here. Come here. Let's see that wiggle. Go ahead and walk to the corner. Yeah, let's wiggle with that, Baba.
Yep.
Keep going.
Yeah.
Feels different, right?
Yeah, it feels like looser, but not in a bad way.
Yeah. Lighter.
Right, maybe that's the word.
Lighter. Sit back here, please. Let's work on let's actually check the neck and see if something shifted. Sit straight. Nope. It's up top. So we're going to do, it's going to be light and quick. I'm going to do it as a critical atlas. C2 left, C1 right. It's going to be nice and light and quick. Chin back, please. Hands on your lap. Palms up to receive. There you go. That's C2. Chin back. Over. Over. And we want to lift there. Just like that.
Huh.
Good. Now C1. Relax the chin. Good. There. I'm holding the rest of your cervical spine firm. You can come see on this side. I want them to see. I'm holding, stabilizing below 2 and the rest of it. Just so we don't. That's the home run. Clunk, double clunk. Hi. Walk it out. Check it out. One more time. And let's open the back just to make sure the wiggle is better. Wasn't a fluke. Walk to the corner. Okay. Have a seat. Less effort to walk now. Have a seat there. Let's rescope. Make sure everything is clear. Starting at the base. Bottom is clear. Neck is clear. T6 is clear. Low back is clear. Now, I want you to feel this. We did S4. I know L5 hurt also. Scoot back a little for me, please. And hands on your lap. Mira, down low, all the way back. Don't be scared. Good. Yes? Mm-hmm. S4. S3. Bueno?
A little bit.
2.
Oh, yeah.
Okay, we need to get to that. This is 5, though. This is 4. 5. It's all tailbone. S2 is where we're going to go to next. Okay. Now you get the buff and polish. Now the fun part. Vibration therapy. I'm a big fan of vibration. I'm not a big fan of percussion. Why now, Papa? Why didn't you come earlier? You just found me?
Yeah.
Yeah, he literally just found you.
Yo, YouTube, I'm mad at you guys. You ain't pushing my stuff out like you used to. Seriously, I'm getting a lot of people now telling me they're just finding.
Yeah.
It's really wild. Right side, please. There you go. Left side. That's it. Ears.
Ow.
On your back.
Maybe you should hear better now.
That was, he told me to. He sent me a message.
Yo.
He emailed, says, please pull her ears. He did it, dude, not me. Hey, on your back. And this is a new style thing, or
Yeah,
this was
it
on
is.
purpose, right?
That's been her whole life.
Yeah.
Yeah, you got a sprained ankle there.
Ow. Sorry, that hurt.
I know it hurt. I'm going to fix it. All right. Sound is the board, not your foot breaking.
Okay.
Clunk. Taps. Fib. Oh! Good papa.
What?
Good dad.
Yeah.
Jokes aside, good dad. They don't all do this, okay? Gotcha. Seriously. Jokes aside. Stand up and walk, please. Now check it out. Now don't tell me you don't feel different. Now you got your swag back. Oh, yeah. Walk on your toes. Check it out. Up high. Stay up on your toes. Up high. Tippy toe. Cool. Over here. Squeeze my hand. Squeeze my hand. Elbow.
Ow. Sorry. Yeah.
Squeeze. There you go.
Sorry.
You crunchy. Squeeze. Squeeze. All right, jokes aside, any questions? You understand what I did and what I found?
Yeah.
So this is a tailbone case.
Right.
Is what we're doing first. We get a couple of adjustments on there. Your job right now is movement, 10,000 steps a day, hiking, swimming, elliptical with the handles is the best, 2-to-1 ratio, 10 minutes forward, 5 minutes backwards. Yoga ball, Sakina's going to go over stuff with you, getting a yoga ball, sitting and bouncing, getting motion and mobility in the spine, and flossing for your shoulders, a video I have on my channel. She'll give you all that information. Just start the movement patterns.
Got it.
Okay? No weights right now. You want to do body weights, ball squats, things like that, I'm fine with that.
Okay.
Okay?
So I'm gonna get better?
Hey, you're already better.
Okay.
Any other questions?
No.
Welcome to the office. How you feel?
I feel good.
What's different?
I
Do some squats. Feel. Just see what it feels like. You should feel
Right.
it completely.
Okay.
Watch.
Can I do anything?
Do what you want. Better?
Yeah.
Yeah. Do it again. No fluke. Better?
Yeah, that's crazy.
That's chiropractic.